Welcome to Doctor's House Call. This is your chance to get in gear with Dr. Gear, a duly trained naturopathic medicine doctor and doctor of chiropractic, board certified in family medicine and minor surgery. Brought to you by Payson Health and Wellness Center at 801 East Highway 260 every Tuesday afternoon from 5 to 6, live on KMOG. You can call in now and speak to the doctor at 474-2427 with any questions, or after the show, call Dr. Gear during regular office hours, 474-7409.
Well, good evening. Mike Farrell here, and welcome to Doctor's House Call. We have 86 degrees right now, by the way. And Dr. Gear, good evening.
Hello, Mike, and everybody out there in Radio Land.
And Dr. Weyrich, good evening to you.
Good evening.
So, doctors, what is your subject tonight?
What do chronic fatigue, Parkinson's, fibromyalgia, and Alzheimer's have in common? Can the common factor be helped to reduce severity or cure the disease? Dr. Weyrich brought that subject up and said, let's do a show on this. And I said, well, Dr. Weyrich, do you know what the common denominator is? He says, I most certainly do. So I'm going to let him explain it to everybody.
So the common denominator is mitochondria, which is the topic that I prepared to discuss tonight. So, Dr. Gear, you want me to go into depth now, or you want to say something else first?
Well, what is mitochondria? Tell me what that is first.
Okay. Mitochondria are small structures that are found in almost every living cell. There are some exceptions, though. Bacteria and sperm do not have mitochondria.
So what is a structure?
Well, I'm glad you asked. In some ways, mitochondria are like bacteria, but they are living inside our cells. And I didn't want to go into great detail about what the structure is,
Wait. Is it a picture, or is it a piece of wood, or is it a motor, or what is it?
It is something that looks a lot like a bacterial cell.
Is it like a motor? It provides energy?
It's more like a battery, but it provides chemical energy.
Okay, so it's an energy-producing structure inside the cell.
That is correct.
Aha. Okay. Now we have it defined.
Okay. And they're very important for human life. Number one, they produce most of the energy used by the cells of our body. And important to a lot of our listeners is they burn fat. Think weight loss if they're working well. Think weight gain if they're not working so well.
Oh, so a woman who has a baby and gains a lot of weight right afterwards has a mitochondria problem.
Yes, which is affected by hormones, in particular the thyroid hormone, but also progesterone affects mitochondria.
So these hormones that are developed in the body can affect the energy producer that's inside the cell.
That is correct.
And it burns fat. And if it's affected adversely, then it doesn't burn the fat.
That's correct.
So what happens to the fat?
It accumulates.
Oh, so the little fat cells get big fat cells.
That is correct.
Yeah, we got, who was that, Buck champion? Remember the game Buck?
No, I don't.
No? Bill, what was his name?
Oh, that's, you're talking about Fat Albert.
I am. He was a Buck champion.
Yes.
Yeah, Fat Albert. So he had a lot of hormone disturbance, huh?
Yeah.
Yeah.
So he had a metabolic issue, I think.
I think he did.
But we'll talk more about fat and some very interesting things about different kinds of fat.
I thought just fat was fat.
No. There is, and these are descriptions of fat and not people. There is brown fat and there is white fat. Brown fat is the good stuff that burns lots of energy. And babies have a lot more of the brown fat than adults do.
What's this yellow fat that I see on steaks?
Well, I think that's fat that's been cooked.
No, it's been hanging out for a while and it's oxidized.
Well, cooking causes oxidation too.
Well, this is in the baker's, in the butcher's cabinet, so it's not cooked.
Well, the brown fat, as we'll talk about, has a lot more mitochondria in it than the white fat, and that's why it's brown, because the mitochondria give it that color.
So the yellow fat could be just a light brown coloration of the fat.
It could be, or the textbooks don't usually talk about yellow fat. It's white fat and brown fat, unless you're a baker, I suppose, or a butcher.
Yeah, well, I used to see it in the butcher shops when I was a little kid, but I haven't been around butcher shops much lately because I don't eat the meat.
Right.
I have an IgG reaction to beef.
Yes.
And pork.
Yes.
So I don't eat those things.
Yes, you may be able to eat some of the more exotic meats like squirrel and possum.
Well, I was thinking more like squid and octopus and bivalves. You know what bivalves are?
They're an aquatic creature.
Clams and musks and mollusks,
Yes.
Yeah, those things.
Those are on your the IgG test, I think.
They are, aren't they? But I can eat them because they're not bad for me.
Okay, fantastic.
So what else about these fats?
Well, let's talk more about the mitochondria that are a lot more than just fats. And the mitochondria do many other chemical reactions in the body. They're really very important parts of our body. And here's something that's very interesting, or I find interesting, about mitochondria. They have their own DNA. So everybody that takes a basic biology class learns that humans have 23 pairs of chromosomes. Every cell, except sperm and eggs, which only have a single copy of each of the 23 chromosomes.
That's because they match up with their opposing number.
Yes. So that's why when a baby is born, it has 23 pairs of chromosomes, one set that came from the mother and one set that came from the father. But that's not the point of this discussion. The point is the mitochondria that are in our cells have separate DNA that's distinct from the 23 pairs of chromosomes that we have in the proper larger portion of our cell. And the mitochondria reproduce independently of our cells. So the mitochondria divide and make more mitochondria inside our cells, or they don't do that and they actually diminish in numbers depending on various stimuli that the mitochondria get from their environment, which is the inside of our cells. And of course, our cells are infected by the outer environment, that is the fluids and so forth that are outside the cells. So
Dr. Weyrich,
yes.
What does all that have to do with shaky hands or tremors in the hands and problems in the central nervous system?
Well, we'll get to that, but the short answer is the central nervous system needs energy. And where does it get that energy? In large part from mitochondria that are inside our brain. So, again, it all comes back to the mitochondria are responsible for making most of the energy. And everything from Parkinson's disease and Alzheimer's to fibromyalgia have an association with mitochondrial health. And we'll talk more about the care and feeding of mitochondria. So that's basically what mitochondria are. But where did they come from? What's with this idea that we have little tiny things, structures inside our cells that sort of act like they're little cells inside our cells? by reproducing and having their own DNA. Well, one theory is that mitochondria were originally independent cells living outside our cells, our ancestors' cells, and at some point they moved into our ancestors' cells and established what's called a symbiotic relationship. That is, you scratch my back, I'll scratch yours. Our cells produce nutrients and so forth in a safe living environment for the mitochondria, and the mitochondria return the favor by making energy for us. So that's a symbiotic relationship.
Sounds more like an alien invasion to me.
Well, some aliens are good. If they scratch our back, we can scratch theirs. They're not parasites that are just leeching off of us. They are our friends. And so the mitochondria supply us with energy and all the other benefits. So now this is a theory that can't be tested by science because we can't use the scientific method to recreate what happened in the primordial ooze a gazillion years ago. But here's some ideas that we could talk about over a cup of coffee or a beer or whatever your beverage of choice is. Remember, I said sperm do not have mitochondria. That's important because that means that all the mitochondria in our body came from our mother, none from the father. So mothers are very important here because they give us all our mitochondria. All of our mitochondrial DNA came from our mother's mitochondrial DNA. Now, all DNA, according to scientific theory, which again can't be tested in the laboratory, is that the mitochondrial DNA mutates. And why is that useful? Well, by making certain assumptions about how fast DNA mutates, we can extrapolate back in time to a point where there was a single woman that is the source of all the mitochondrial DNA that we have today. A single unique woman who is the ancestor of all living humans. This person is sometimes called the mitochondrial Eve. Now, depending on the scientific assumptions made, and our scientists go back and forth over which assumptions are the best assumptions, but the mitochondrial Eve lived somewhere between 5,000 years ago and 200,000 years ago. Now, that doesn't mean that this mitochondrial Eve was necessarily the first human. Could be, but she may also just be the sole survivor of some bottleneck cataclysm, a near extinction event, where a previously large human population was culled down to just a few surviving humans. And again, we don't know that. It's all speculation.
That's interesting scientific theory, but it's just theory. Go ahead.
Yes, but it gives context to what mitochondria are. And it's also possible that a certain number of bloodlines carrying mitochondrial variations became extinct. That happens all the time. Anytime a woman fails to produce a female offspring that's capable of passing on her DNA, that bloodline of DNA is gone forever.
So what does all this have to do with chronic fatigue and Parkinson's disease and fibromyalgia and Alzheimer's disease?
Okay, so now we know what mitochondria are, and now why do we care about mitochondria? Well, mitochondria are an important component in weight and energy management. When we have lots of healthy mitochondria, we burn more fat and we have more energy. And we don't accumulate as much fat, and we don't have chronic fatigue and fibromyalgia, and we don't get neurodegenerative diseases like, as I said, Alzheimer's and Parkinson's, Lou Gehrig's disease. There's a whole long litany of neurodegenerative diseases that are associated with problems with mitochondria in various parts of the brain or body. So here's the bottom line. How do we keep our mitochondria healthy? First step is to optimize our thyroid hormone, because it controls mitochondrial function. A lot of thyroid hormone, mitochondria are more active and tend to reproduce, and we have more mitochondria to make more energy and to burn more fat. Then we have to feed them right. All the B vitamins are necessary. CoQ10 is necessary. Good fats are necessary. And something called carnitine is necessary, because carnitine is a nutrient that is necessary to help get fats from outside the mitochondria into the inside of the mitochondria so that the fat can be burned. Now, think about the name for a minute. Carnitine. What, especially those of you who know of a romance language, Spanish, Italian, so forth, Latin. What does carnitine sound like? Dr. Gear?
Food.
No, it sounds to be like carne in Spanish.
What is her name?
Carne. C-A-R-N-E.
What is carne?
Meat. So.
Oh, that's because I don't eat meat. I don't know what that word means.
Well, you eat something that approximates meat.
Oh.
You just don't eat
I eat biscotta.
Well, carnitine is in various meat sources, including your squid and so forth. It's not found in vegetables.
I was thinking carne was beef.
No. Carne, more generally, in the Latin-based languages, is any kind of meat.
Oh, so it's fish meat?
Yes.
Or mammal meat?
Yes.
Or dinosaur meat?
Well, I assume that dinosaurs had the same basic biochemistry that we do. But
all the chickens. That's dinosaurs.
Well.
And birds, you know.
That's scientific speculation. That I don't think that they have the enough DNA evidence to establish what the biochemical makeup of dinosaurs was. We're not even sure whether they were warm or cold-blooded.
Well, there were a whole bunch of birds that were in the same time frame, and the dinosaurs had feathers like birds, and they had the same anatomy as a bird. Therefore, I'm going to call birds dinosaurs.
Well, you're not going to call them snakes or reptiles? They look a lot like reptiles, too.
Reptiles don't have any legs. Snakes. Snake reptiles.
Lizards.
Lizards have legs, yeah.
Yes.
You know, that's enough nonsense.
Yes, we were talking about horny toads last time.
We did, didn't we?
Yes.
Yeah.
But those we can go out and study today. But carnitine is necessary to burn fat. People that don't eat various animal products tend to be low in carnitine. And therefore they don't burn fat well, and they tend to accumulate the fat perhaps, and they tend to be lower in energy. But you can buy carnitine supplements. And then there's CoQ10, which is essential for the proper functioning of mitochondria. And you can get CoQ10 from various foods, but your body also makes CoQ10, except if you are taking a certain class of drugs called statin drugs to fight high cholesterol. And the drugs that fight cholesterol because their statin drugs also prevent the formation of CoQ10 in the body.
So if you take CoQ10 and you're taking a statin drug, what does it do to the CoQ10 you're taking?
It benefits the mitochondria.
The statin drug doesn't kill the CoQ10 that you take as a supplement?
No. The statin drug prevents an earlier step in the process of making CoQ10 from happening.
Oh, so it doesn't affect the CoQ10 itself after it's already made.
Correct.
So a good reason for taking CoQ10 if you're on a statin drug.
Absolutely. And any patient that I have that is taking a statin drug, I absolutely urge them to take CoQ10. Any patient that I have that I suspect that their mitochondria are struggling, I urge them to take all the nutrients that I listed, and perhaps even undergo testing to identify any particular nutrient weaknesses that a person might have.
And so if we're doing that, we have the IgG test to tell us what foods a person's eating that might cause inflammation and block the digestion assimilation of that nutrient from the diet that a person has.
Right. There's lots of different ways to look at the biochemical balance in the body, and the IgG test is an important way, but it's not the only way by any means.
No, we got the S3 test also.
Yes, and that looks at antioxidant status in the body, which is another thing that mitochondria need to keep themselves from burning up.
So we find someone with a very low S3 test, that's the low amount of, what's that called, carotenoids?
Yes.
Low amount of carotenoids in the body's fat, then that means they might be in dire shape in their mitochondria function.
They might be. And then there are various methods of fasting, intermittent fasting, reduced calorie diet, benefits mitochondria. And here is something interesting that I learned from a recent symposium that I attended as part of my continuing medical education. There are herbs that actually promote increases in mitochondria, and they tend to, in actual studies, create more brown fat, which is the metabolically active fat that generates heat energy and basically consumes itself so that we don't accumulate too much of the white stuff around our middle. And these herbs are traditionally used as adaptogens that improve athletic performance and all kinds of benefits, improve the functioning of our adrenal system. And these adaptogenic herbs are something that I am going to be including in future diet programs. We're working on developing a more robust diet program for our patients at Patient Health and Wellness.
Yes, Dr. Brent Gear used to have a weight program here in Payson when he worked at the hospital here, and even for a couple years afterwards. And I just spoke with him today, and he's going to help us at Payson Health and Wellness Center continue and carry out his weight loss program. So if any of you are interested in weight loss and you want to sign up for this very effective, he's a bariatric specialist. That means he's a physician who has taken additional training to learn how to handle weight loss in people, and he does it without cutting surgery and without too much drugs. There's a certain amount of them that stimulate the burning of the brown fat and also not accumulating the white fat. So he's got this whole program. He's going to be outlining it for us so that we can do his very effective weight loss program at Payson Health and Wellness.
Yes, he includes vitamin injections. I talked about how important the B vitamins are for mitochondria, and he has his patients receiving regular injections of B vitamins, among other things. And he recommends carnitine, but he has a 7-step program that looks at all aspects of the body from the whole healthy, whole person perspective.
So as soon as we put a person onto a diet using the IgG testing, they start to lose weight and they start to feel better immediately. Within 2 weeks, it's phenomenal. And then we add to that all this other information that we were getting from him regarding the board's bariatric board certified program. It's going to be phenomenal for people who really want to get a lot of that weight off, because that weight has been found to be the premier reason for cardiovascular disease. That's blood vessels as well as heart and all of the things that affects in the body. So it's you're anti-aging, Dr. Weyrich. This is a number one way to be anti-aging.
Absolutely. Dropping 10% of your body weight cuts your risk of dying of chronic disease in half.
Yeah, he just told me today, he says, Dad, I know you're getting up there, you're going to be 80 this year, but you don't look it. And I don't act it and I don't think it. But I am going to be 80 this year. I suffer from all of the vicissitudes of my youth, the injuries that I got, but I've been getting regular care for the last year and a half. It's been very effective. I spend 3 hours every Monday traveling to this doctor in Snowflake, Dr. Bowman, and he's been very, very effective for me. So I highly recommend getting regular chiropractic care. And you know, people ask, what in the world can a chiropractic adjustment do for all of these central nervous system disorders? Dr. Weyrich, you had that same question several years ago, and you have seen in actual activity of treating patients the changes in people's central nervous system.
Yes, I have, especially one Parkinson's patient that I've been working with for a number of months now, who is so much better off now than he was when he first came to us. And I don't know how much credit I can take and how much credit I have to give to Dr. Geer, but in my point of view, it is all synergistic. It all builds on each other, and looking at both the internal chemistry as well as the body structure, it's all important. That's the end of our discussion of mitochondria for today's show. But wait, there's more. In part 2 of our show for August 24th, 2021, Dr. Geer will lead a discussion of neuroplasticity and the effect of chiropractic treatments on brain function. Stay tuned to find out what neuroplasticity is all about. Dr. Weyrich here. If you like this video, please share with your friends and visit the website drweyrich.com/multimedia-archive, where you will find additional information about this and many other topics. Now, I want to turn it over to you. What was the most important thing you learned from this video? What more do you want to know? Let me know by leaving a comment below. Thanks.